2 nights ago, we broke down the similarities and the differences between the 1918 flu pandemic and the current COVID-19 outbreak. Tonight, we're taking a look at how the 102-year-old pandemic impacted the greater Cincinnati region. According to the Influenza Archive Encyclopedia produced by the University of Michigan, the Queen City took quick action, but there was still a relatively high death rate. The Spanish flu first hit Cincy in early October of 1918. The city's health commissioner at the time, Dr. William Peters, took drastic action nearly a week earlier than other major cities in Ohio. That action included first barring all visitors to hospitals in the city, except those calling on critical cases. Then all schools, both public and private, were closed, as well as theaters, churches, and then even restaurants. Sound familiar? Saloons were spared, but alcohol had to be consumed off the premises. All public or private meetings, both indoors and outdoors, were also prohibited. First aware of influenza reports coming out of Boston, the Queen City's Nurses and Physicians General Council initiated preventative measures against the flu before it spread here. A handbill showing the possible dangers of an influenza outbreak, including restrictions or instructions on prevention and treatment, was distributed to families across the city. The handbills also stressed the importance of prompt medical attention. The city's mayor at the time, John Galvin, who served from 1918 to 1921, was optimistic about how Cincinnati was handling the flu. He was quoted by the press at the time as saying, quote, "There is no epidemic here." He added that we are doing what other cities should have done. We are preventing. Still, according to the Influenza Archive Encyclopedia, about 1,700 people died from the Spanish flu in Cincinnati. The vast majority of the deaths were seen in children and working-age adults.